Um, when you are seeking an evaluation for ADHD, it's good to go to a professional who recognizes the following things. That ADHD does vary from one setting to the next. So if I only evaluated kids in a clinic and just based my evaluation on what I saw in the clinic, there'd be very, very, very few kids in the world with ADHD. And I would be thinking that their parents and teachers are liars because they're telling me horrible stories about this child and I didn't see any of this in the clinic. Well, the reason I might not have seen it in the clinic is because it's a novel situation, it's one-on-one, and most of the things that I'm asking a child to do are structured with a lot of feedback. Those are exactly the conditions under which you would predict not to see ADHD. I've already mentioned this, that ADHD is often accompanied by other problems. So when you are, just don't throw it at me, that's all. I'll catch it though. ADHD is accompanied by other problems. So if you're seeking an evaluation, you want to go to a medical or mental health professional or educational professional who is aware of all the other things that can go along with ADHD. Because what you don't want to do is only identify ADHD if in fact other things are happening. Because then you develop a treatment plan only for ADHD when you should have a treatment plan for ADHD, learning disabilities, an anxiety problem, a peer relationship problem, and so on and so forth. I'll talk about this momentarily, that ADHD disrupts family functioning. So it's always good to go to an evaluator who understands that while the problem rests within the child's ADHD has an impact on the family. And the family plays an enormous role in trying to provide services on behalf of that child. So it's really good to include an assessment of what's going on in the family as well as the child. Finally, there are professional guidelines for diagnosing ADHD. And you really want to make sure that any evaluator you use is familiar with those professional guidelines and follows those guidelines. Otherwise, all of us professionals would have a different definition of what ADHD is, and we'd be creating quite a mess for the field. In order to do the things that I just talked about, it's important to have evaluations in which multiple informants provide information. So while I generally believe what mom's telling me about a child, I'd like to hear what dad has to say because he sees the child in somewhat different conditions. And I really want to hear what the teachers have to say because he or she may see the child under even very different conditions. So the more informants we have, the bigger and more accurate picture is painted of what that child's ADHD and associated features might be. We also want to use multiple measures to assess those constructs. So we're going to use various interviews and rating scales and observations and psychological tests and so forth. So when you put all of those pieces of evaluation data together, it creates a picture. The less amount of information you have, the less clear the ADHD picture is. The more evaluation data you accumulate, the clearer the diagnosis is or is not. So I think in general you want to aspire to find folks to evaluate by collecting a lot of information from a lot of different informants using a lot of different methods that address not only ADHD but other things as well. Okay, that's the quick assessment story. Any questions about that?
Are you referring to ADHD? Is it all ADD, ADHD combination?
The present criteria describe ADHD as the broad category under which you've got subcategories. So what used to be called ADD without the H is now known as ADHD, predominantly inattentive type. If you have a lot of hyperactive impulsive features but not a lot of inattention, that's ADHD, predominantly hyperactive impulsive type. But if you have a lot of inattention and you have a lot of hyperactive impulsive features, that's ADHD combined type. So everybody gets the ADHD label, but then there's a subtype description after that. And those are the criteria that we use in the field. Other questions about this? Okay. Treatment. So what are the things about what I just told you that affect our choice of treatment? Same kinds of things. ADHD varies from one setting to the next. So to give you an example, if a child has mild ADHD symptoms in school, but more severe ADHD symptoms at home, which would be unusual, but it does happen, that may not be a good candidate for stimulant medication therapy, because stimulant medication is used mainly during the daytime hours. And if the problem's not at school, why are you using a treatment that's a daytime based treatment for a problem that's more difficult in the it doesn't make sense. So we need to understand where the settings are, where the symptoms are occurring in what settings. If other conditions, depression, anxiety, LD, are accompanying ADHD, they've got to be included in the treatment plan. You can't just treat the ADHD and forget about those other things, because those other things can make managing that child even more challenging and difficult. And likewise, the child with ADHD is not always the only target for treatment. Sometimes you've got to be treating other members of the family for various things that may be going on. High stress levels, parental depression, marital discord, sibling issues, and so on and so forth. So we try to look at a child with ADHD in a more holistic, big picture, family systems context, not just it's the child. There's a bigger picture to deal with. And so these are some of the research-supported treatments for ADHD. Psychotherapy, pharmacotherapy, especially stimulant medication, is very, very strongly supported by research. But it doesn't mean that every child with ADHD gets medication. It depends. We know that we do a parent training program in our clinic. It's an evidence-based program specific to parents of kids with ADHD. There are lots of classroom modifications that educators can make in terms of curriculum, teaching strategies. Psychologists are also using other kinds of strategies to help kids do better in school. I've already mentioned the summer treatment program. All of these are treatments that research has shown are effective for many families of kids with ADHD. These are things that don't necessarily target ADHD, but target other things that go along with ADHD. So individual therapy for the child is not going to fix the ADHD, but it might help them with self-esteem. Family therapy isn't going to get rid of the child's ADHD, but might teach the family how to get along better in dealing with that child's ADHD. Same thing with social skills training, academic tutoring, and many, many other things. And these are some of the other treatments that one potentially would consider including in a child's overall treatment plan. The main message here is that one size does not fit all. There is no one treatment for ADHD for every child with ADHD. There are multiple treatments that could be used in the clinical management of ADHD. And so the job of any evaluator or treatment person is to figure out what is the lay of the land, what are the problems that are going on, where are they occurring, under what settings, under what conditions, and what are the treatments that research suggests could help those problems in those settings at those times of day. And so you sort of piece together, if you will, a treatment puzzle. And for one child, this might be the combination of treatments that are used, and for another child, this might be the combination. But not every child gets exactly the same combination of treatment. It just depends. So, the question is, if a child has a dual diagnosis of ADHD and oppositional defiant disorder, would you still treat with medicine? And the answer would be yes. You're using the medicine, mainly stimulants, to continue to treat the ADHD. And as you bring that down, in some cases you actually reduce the oppositional defiant disorder, but the most effective treatments for oppositional defiant disorder are home-based and school-based behavior modification programming, like the parenting program that I mentioned a moment ago.